Be advised, the opinions and views of the hosts and guests do not reflect those of the station.
Good morning, Philippines. You're watching the Business Portal, your gateway to health and beauty, trends, and opportunities. I'm your host, Dr. John Cenica for What's Up, Doc? Yes, we have a very interesting topic for this morning. It's all about perfect smile. Before anything, I would like to introduce to you my beautiful natural co-host, no other than an intern from Carino Medical Center, Dr. JONNA Cenica. Good
Hello,
morning, Jonna.
Good morning. Good morning to everyone who's watching here, and welcome to What's Up, Doc. And now we're gonna have a very interesting topic for today, which is the perfect smile. First of all, my first question. What does it take for a person to have the perfect smile?
Okay, a perfect smile, before anything else, that will be answered by our, I could say, an icon in cosmetic dentistry and maxillofacial surgery. And we have two good-looking, gorgeous, and I could say a beauty queen look-alike doctors. No other than she is the dental director of PINEDA Medical Clinic, a TEMPORO mandibular joint specialist. No other than Dr. Janet Pineda. Good morning, Dr. Janet. Welcome to What's Up, Doc. Our next guest is a training director of in hospital dentistry, and also a maxillofacial surgeon, no other than Dr. Lucia Valderama. Good morning, Dr. Valderama.
Good morning.
Yes, can you see that our doctors are really two great women, and as I've said, an icon in maxillofacial.
Bagay yung topic natin for them, the perfect smile, because they also have perfect smile.
There you go. Okay. Now, you know, there's a lot of patients been asking about. Let's start with the tooth whitening, right? So are you not taking any oral treatments for teeth whitening, or what do you do for a patient who wants to get white, Dr. Pineda?
It's a very common procedure, I think.
Yes.
Yes, but you have to consider first, you have to evaluate the patient.
Right.
If there are any restorations or pasta, there shouldn't be any leak. Because the bleaching solutions that you will use could penetrate the pulp, thus causing discomfort and pain.
So you mean there is also like a medicine that you have to apply directly to the teeth of a patient to make it white?
It could be they call it instant white.
Instant whitening.
You apply the solution to teeth at the dental clinic, and then you put like a laser light to oxidize the medicines. And then you can see at least up to 10 shades maximum lighter from the original color. And the other one is take-home bleach. You instruct the patient to do it. You give them the tray and the bleaching solutions, and then they wear it for like 8 hours a day until they achieve the white they want.
Oh, okay. Now, before anything else, I would just like to tell to our televiewers that you can ask your question directly and to our cell phone, and you can text us at 0922-891-6761, and please indicate your name and your location where you are at right now. And our topic for this morning is all about perfect smile. But maraming ano to ang perfect smile. There's a lot of varieties, components, you know.
Aside from having a perfect set of teeth. Meron pang iba dyan.
We'll discuss about tooth whitening, braces, symmetry of the face, mandibular problems, and emergencies, and napaka-interesting ang topic.
Yes, and not just that. Aside from the whitening and the cosmetic procedures, we will also discuss today the failures in some of the surgeries with oral dentistry or oral surgery, right? Okay, just another follow-up question about teeth whitening. How long does it take? How long does the procedure take?
About an hour.
About an hour.
Then instantly you can have a white teeth.
Yes.
Parang ano yan eh, uso-uso din ngayon yung mga skin whitening, applying glutathione, you know. Ngayon, it's also a fad to have a white teeth because you can see, minsan meron tinatawag na hepatitic teeth, yung nag-yellowish yung...
And the tetracycline stain.
Tetracycline. Can that be treated, those tetracycline babies?
Cannot.
Oh, so what do you do?
You have to do veneers.
Veneers. So when you say veneers, it's just like, how do you do that? When you say
You
veneers?
have to prepare the labial portion of the crown portion, about reduction of about 0.5 millimeters, and then you put like a fake nail.
Oh, okay. And then does it take a lot, so many long?
A lot of treatments or sessions?
Several weeks to have.
No, you just have to prepare the tooth and take the impression, send it to lab, and the patient goes back for trial and then cement the veneers.
Yes.
And
Doctor,
it's more permanent, the effect is more permanent because using the bleaching solution, in the teeth, it could again go back to its original color when you drink coffee, iced tea. It's like bleaching the skin and then you go out of the sun. The principle is the same.
Okay. Dr. Valderama, regarding when you say oral maxillofacial surgeon, what does it mean? You say it's an oral, it means mouth, maxillofacial, ito yung baba, and you are a surgeon. You know, when you say that, what does a patient prompt to seek your services?
What are the common problems, their common concerns about maxillofacial?
All right, when you say oral maxillofacial, this deals with dentofacial structures like the maxillary, the maxillary bone and the arches and the teeth associated with it and the surrounding structures. We also have the lower jaw or what we call the mandible. Now the second question is what prompts the patient to seek consult from us. Basically, the most predominant in the practice, like 78%, will be, I would say, about more of the impacted teeth.
Impacted teeth.
And those lesions associated with this impacted teeth.
Okay. When you say impacted teeth, in a layman term, how what does the patient feel having these impacted teeth?
All right. The symptoms that the patients feel, when you say impacted, these are abnormally positioned or teeth which do not erupt normally because there's insufficient space to get out from the jaw. Now, what prompts them to see is because there's pain. It creates a pressure on the adjacent tooth which elucidates pain. Sometimes it is a source of infection. And the others, they will just keep on taking antibiotics. And by the time there's severe swelling, that really prompts them to see the doctor.
Okay. So that really gives you severe pain and sometimes hindi ka makatulog.
Yes.
Inability to sleep because of those pain on their hirap nun.
Sometimes if you notice...
Can you tell that this is an emergency case wherein really you cannot tolerate anymore the pain, the tooth pain that you have for the whole night, that you have to seek consultation to a maxillofacial surgeon. Go to the... Where's the right place to go? Do you have to go to the clinic or you have to go to... Is there any like a dental, just like you are a hospital dentist and to seek your advice maybe during emergencies like having those severe pain?
Sabi nga nila, usually ang sakit sa ngipin daw, ito daw yung pinakamasakit na pain eh.
Oo nga.
Yes, because it doesn't make you really sleep. It's very uncomfortable. When you speak of pain, it is a more or less localized sensation of distress.
Okay.
Parang agony, in agony ka kaya.
Wow. Okay, we have a text question.
Yes.
Dr. Joanna, can you read that?
Okay, how many sessions do you do for teeth whitening and how much per session?
There you go.
Thank you.
There's always been a question about how much.
I knew it. It was coming.
How many sessions does the teeth whitening from cell phone ending at 4526?
It could, yung instant, they call it, where you make use of the light.
Okay.
You go out of the clinic with your teeth white.
White.
It costs around, it ranges from
15
to 25.
15 to 25. But you get a perfect smile after
Instant.
that.
With one session only. Does it last that long?
Usually it lasts for about a year to 2.
Oh,
2 years.
that's
Not bad.
good enough.
Just like buying a cell phone. How much is your cellular phone? Di ba? Around mga high-end, mga around 20 to 30
Yes,
to 40,000.
but you have to avoid
certain
foods and especially sodas, iced teas, coffees, because it causes pain.
Those drinks that has caffeine, right?
Yes.
Oh, okay. Now, Doctor, when you undergo surgery or you undergo like those impacted tooth has to be removed, does it need to be in an operating room or just a dental setup?
Clinic
dental
setting?
clinic setup?
You can do it actually in a chair side setting, which means in a regular dental office.
Yes.
But I would highly suggest if it's more than one impacted tooth that they be sedated. It really depends on the anxiety level. Anxiety level means if the patient is too anxious, anxious means fearful siya just of the sound, then I suggest we put the patient in a controlled state of sedation.
You know, I didn't know that there are also a lot of dental emergencies. You know, when you say dental emergencies, I've said that there's a lot of course, when you say pag sinabing ano yan sa ngipin, they just go directly to the dentist or to the clinics, and we didn't know that we have what you call a hospital setup in a dental setup in a hospital setting, and then other, let's say, for example, having this kind of oral surgery that has to be done in the hospital. There's a lot of, I could say, patients that didn't know that the dentist could also do surgery in a hospital setup.
Sabi nga kanina ni Doktora na we were thinking na yung dentist, just ito, pupunta ka sa dentist, papabunot, papa-whitening braces, and then she was talking a while ago about there are so many dental emergencies that she has already experienced in the hospital, right?
What are these dental emergencies that you could that you encounter during your practice, Doctor?
All right, a lot is about severe infection of the face, which causes facial deformity.
Wow.
Okay.
For these cases, sometimes they can't wait. I suggest they be done immediately under an OR setting, so we can put tubes to drain them.
Right.
And then the second most common is probably trauma. Let's say, example, yung mga nagbabasketball, natamaan ng bola.
Correct.
Because of the amount of pressure, natatanggal yung mga teeth. You can put them back, and that can be done on chair side.
Wow.
And then the other one, implant failures. And the other, well, one of the most common that I have is patients coming from other and then accidentally, well, usually these cases occur in mission. Mission works. There's an inadvertent amount of pressure, and what happens is the tooth gets into the sinus.
The sinus.
The sinus.
Yes.
So you mean like, for example, if I went to the dentist and have the tooth extraction done, nagkakamali din pala ang mga dentist o minsan napapa...
Yes.
You said that during tooth extraction, this tooth goes to the sinus.
Yes.
So what do you do? I mean, you know.
That's the time they refer
it will
it
not be,
to.
Yes, they will refer.
That can be extracted talaga, yung in a regular setup of
No,
tooth
you
extraction.
can't. Because when the tooth gets into the sinus, the problem there will be the access. So there will be a different type of treatment.
Access to the sinus.
Yes, access to the sinus will be different.
Okay. So it makes things worse, huh?
A little complicated.
You have an impacted teeth, and then suddenly you have a teeth in your sinus, right?
Yes.
Which is even worse.
Doctora Pineda, is there any remedy for something like if you really want, let's say, siyempre during a problem, they always have pain. Okay. Do you have any home remedies that you could apply, like for example, any creams or something that you can buy at the drugstore, anesthesia or a topical anesthesia, to relieve the pain of a patient?
No creams. You have to take oral antiseptics.
antiseptics or oral analgesics, and then after that.
And you really have to go to the dentist for consultation to know where the pain comes from.
Okay. What are the causes of pain, dental pain? I mean, for a regular patient, or do you need like kailan ba extract na agad ng ngipin, or like you have to clean ba the teeth? Kasi pag alam natin kapag we have a dental pain, bulok yung ngipin. Is there or any other cases is not really nagkaroon ng tooth problem na let's say they need only cleaning or whatsoever?
Yes, one of the causes of course is the dental caries.
Dental caries.
Periodontal disease, infection, and some people maybe they consult, they don't have cavities. The teeth are perfectly good, but they have pains in their jaws, face, cheeks.
So that's where the temporomandibular joint specialists come, right? So okay, let's talk about what we call it TMJ. How do you diagnose TMJ?
So it's very common, I think, right?
Yeah. Nowadays, yes, it is. Patients with temporomandibular joint disorder usually manifest several symptoms like clicking or popping of jaw upon chewing, yawning.
So it's really very important if a patient feel like a clicking sound on your jaws, you have to have a treatment to a TMJ specialist. Yes, and then what will be, these are the signs and symptoms when you have like click.
That's the initial.
What else are they gonna feel? That what would they feel that would prompt them to seek consult about TMJ?
Usually these patients on the latter stage have locked jaws. They cannot open their mouth
or
wide
close
enough,
their
or
mouth.
they cannot close their mouth.
Wow. So what do you do? What is an immediate emergency procedures at home if you have that kind of locked jaw?
What do you do if you get the lock?
You have to relax the muscle. No, you have to relax the muscle.
Relax the muscles
on the areas, and then
how
put
do you do
warm
that?
or cold compress.
There you go. Warm or cold compress.
And,
How about giving some muscle relaxant? There you go. Okay, and also some painkillers, right?
Yes.
Then after that, it's a dental emergency, doctora. Like, can you call like a
lockjaw?
Yes.
what do you call ambulance for that, and then bring them to the hospital? Or did you have any experience like that?
A lot.
A lot.
Actually, it was
Really?
one instance, it was Christmas, and he kept on laughing
Yeah,
to the
correct.
point nag-lock yung jaw.
During family reunion.
So
right?
I suggest you go immediately to your surgeon. If he's within the area, try to see him, or within the country. So
But
that you unlock it
very-
immediately.
So to tell the truth, this is the first time I met somebody whose specialty is oral maxillofacial surgery. But I don't want to go to something like somebody like who's just a dental clinic and have a locked jaw, or either I didn't know that there's a specialist in oral maxillofacial surgery like the TMJs, and somebody who has like this ang hirap noon. Locked jaw. I mean, you cannot talk, you cannot even say what's going on.
You can't eat.
It's classified. Lockjaw is classified. Na dalawa siya. It's open lock.
Open
You cannot close.
Uh-huh.
It's closed lock. You cannot open.
Parang kang na-stroke yun eh. Di ba, ang feeling mo parang, maybe
You
some of
can't
the
eat.
relatives thought that na-stroke ka because you can't even talk.
You can't eat, you can't drink, you can't talk, right?
Okay. Now, we know that you have a lot of dental emergency, we call it dental emergencies. Other than having infections or what other, like for example, foreign body left in the mouth. Do you have any cases like that?
Yes. Example, another case being done by another doctor and accidentally leaves, example, the burr inside the sockets.
Yes.
But they don't tell the patient that something was left there. And here comes a patient. The patient comes to me and says, there's severe pain. But according to the patient, she already went to a previous doctor and it was already done. So when we took another series of radiographs,
there goes the
there
problem.
goes the problem.
Right.
Wow.
Anything foreign, that's not supposed to belong into the socket should be surgically removed. Otherwise, it gives rise to the formation of a possible mass or infection.
Yes.
Right. We already have lots of text questions, but before we proceed to any of them.
Yes, and we have some having questions like the boundaries between an ENT or ear, nose, and throat surgeon and a maxillofacial surgeon. And we will answer all those questions when WhatsApp Doc returns. Yes, and we're back here in What's Up Doc. What we're discussing right now is all about a perfect smile. Of course, our two good-looking doctors who are specialists in temporomandibular joints, and with Dr. Janet Pineda. And our one is the training director of Metropolitan Medical Center in Hospital Dentistry, a maxillofacial surgeon, an oral maxillofacial surgeon, rather than Dr. Lucia Valderama. Of course, my co-host, Dr. JONNA Cenica. Now, we have a hanging question, Dr. Valderama. We're in, is there any boundaries between where is the our maxillofacial surgeon enters into the scene in comparison with the ENT or the ear, nose, and throat specialists? What's the boundary between them?
Well, here in the practice in the country, basically they can do both as long as, but you see, when it comes to trauma of the jaw, well, of course, I'm biased. I would most likely ask for a consult from an oral max. You see, even if no matter how good the reduction of a fracture or trauma cases in the jaw, but you don't have a good occlusion, then it defeats the purpose.
Correct.
You need good occlusion because you see, occlusion is an indirect index of a fracture. Fracture means may bali sa panga.
Okay.
Or it's also good if you can work hand in hand with an ENT, so both of you can do it.
Where does then a plastic surgeon enters into the scene?
Well, some of the plastic surgeons also do some of the fractures. Well, probably if there are some soft tissue which involves the facial structures, skin, the lips, which has to be fixed in coordination, I think it's always best to treat it as a surgical team.
Okay.
Rather than just an independent group.
We have a text question from Jake, Dr. JONNA.
Good day po. Gusto kong itanong kung anong mabuti sa gum na sumasakit. Salamat po. So,
Dr. Pineda?
Gum pain.
Yeah, gum pain.
You have to seek consult first because there are so many reasons why there's a gum pain.
Okay.
First, you have calcular deposit. You have to ask your dentist to do prophylaxis.
Prophylaxis, okay.
It's one of
so let's say a home remedy having a gum pain. Is there any home remedy? You just have to take some painkillers.
You have to have your teeth clean first.
So you have to really to visit a dentist. Kasi tayo minsan we forgot to. Minsan you forgot to visit a dentist, you know, because of probably you're so busy, you know, and. How frequent does you need to visit a dentist?
The basic question.
Yeah.
How frequent?
Talagang kinakailangan, is it every week ba, or every month, or once in 6 months, or Dr. Pineda?
Kapag yung patient mabilis mag-form ng calcular deposit, usually quarterly yung visit.
Quarterly,
every 4 months.
Every 3 or 4 months, right?
Pero pag okay naman siya, oral flora, pH, and good oral habits, 1 or 2, twice a year.
Twice a year. Was there, you know, Dr. Valderama, there's a lot of advertisement right now regarding toothpaste. You know, this toothpaste is good, this toothpaste is that. There's some very expensive tooth for the gums. How true it is, Dr. Valderama?
Well, most of them Well, as long as they can be used to clean teeth, I think all of them are good. It depends. Like, example, when there is swelling of the gums, then you use something. Can I just mention a brand?
Yeah.
Sure.
Okay.
Pag sinabing pamamaga ng gilagid, sometimes the periodontists or the gum dentists, they advise the use of Pyodontil or Gumtech by Happy.
That's what I'm using.
Yeah, that's
But it's quite expensive, huh? It's quite expensive that those toothpaste.
Pag sinabing sensitive teeth, then you use brands like Sensodyne, the Colgate Pain Relief.
Pro sensitive.
Yeah.
Oh.
Pro sensitive
Relief, okay.
Okay, so let's go to the consults regarding the teeth that cannot be whitened by lasers or take-home preparations. Do they usually opt to seek consult to you guys, and do they usually prefer to have like yung implants, or sometimes do they ask you, I need implants? Do you prefer to do implants if their teeth cannot be whitened or fixed anymore? When do you prefer to give implants, or what are the indications for teeth implants?
If the teeth are really non-restorable, before you put this implant, sometimes they'd advise you to put the graft material. Graft means yung bone, dried freeze bone. It's really case to case, dependent. The older you are, the weaker the teeth. So that's the time when the teeth cannot be restored anymore, and there's no other option. Kaya lang po, hindi lahat ng tao good candidates for implants. If you are a medically compromised patient, kasi in AHA, there are 6 classifications, remember? If you are the type who is compromised, like what is a compromised or complex patient? Example, severe diabetic. That affects also your gum tissue. And therefore, the healing takes a longer time and very prone to infection. These are not very good candidates for dental implants. I would probably say those patients who can maintain a very good oral hygiene regimen are very good candidates for dental implants.
Now, you know, we have this what we call medical tourism, you know. Just like in our practice in cosmetic surgery, several patients were coming abroad and seek treatment for cosmetic surgery. Do you also encounter like patients who wants to undergo this kind of procedure, like maxillofacial surgeries or TMJ patients coming from abroad, like foreigners, and having these dental implants? Do you also participate in medical tourism?
Yes, I do.
Okay. So what are the cases that you encounter during
most
those foreigners who come? Because they know that it's very, you know, dental implants in the States.
They're
so
very
expensive.
much expensive.
Man, you know, here in the Philippines, I don't know how much it is, but
I guess it's more affordable.
And one thing more, the Filipino doctors are more skilled. You know, hindi naman tayo discriminative, but I can say we are more skilled in regarding the technical aspect of having dental implants, TMJs, and maxillofacial surgery. So what are the cases that you encounter for medical tourism?
In medical tourism, most of the cases I encounter are basically those teeth associated with cystic lesions.
Oh, okay. Oh, that would be very
more of small tumors in the mouth and several impacted teeth. It's still cheaper to have yourselves done here and do the other procedures than being done in the United States.
What are these tumors that you encountered, probably for children or adults?
Mostly adults, between the age of 35 to 60 years old. They are benign tumors. And this occurs because most of them are a result of trauma when they were young. So if you have an impacted tooth, example, this tooth is enclosed by a sac. Let's say you fell from a bike at the age of 16 or 14 years old. What happens is at the time when these impacted teeth are just starting to get off or out, this sac breaks off and fluid enters, and that's when it starts to accumulate. But it doesn't prompt the patient to seek consult if there's really no pain. So it will take them several years. By the time there is already swelling on the face, that is the time it prompts them to see an oral surgeon.
Now, Dr. Pineda, when you say TMJ or the temporomandibular joints disorders, you say that if you feel like may mga cracking sounds or tickling sounds, and that's the one that will prompt you to go to a TMJ specialist, just like Dr. Pineda. What is the first treatment that you can do for patients who have this kind of problem?
First, you have to evaluate the patients very well.
So you mean, do you do X-rays also?
Yes, you have to request.
Who do the X-rays? Do you have to go to a
you
hospital?
Send it to any diagnostic center.
Diagnostic centers.
Usually in the malls they have, and hospitals as well.
Okay. And then after the X-rays, do you do braces agad or
usually may several stages of treatment.
Okay.
First stage is the rehabilitation of the muscles first. In correcting the bite using a bite splint or a dental orthotic. It's a removable appliance.
How long do you have to do that?
With the splint?
Around 3 to 9 months.
3 to 9 months.
Depending on the severity of the case.
So it's like a retainer?
Yes, but
it looks like
you reposition the jaw
okay.
downward and forward to decompress the temporomandibular jaw.
Does it produce also severe pain?
Yes, it produces headaches, migraine pains, backaches, neck pains,
so that means that it's not only like having a tooth pain, but rather maybe your back pains, your headache. Kasi kahit anong painkiller ibigay nila, they thought it's a migraine headache, or probably they're so stressed about their back.
Sometimes you really don't realize that it's already, it's actually TMJ. You're thinking it's just migraine, diba?
You're just stressed out.
You're just stressed out. So, importante pala yung you have to visit a specialist, not only like a regular dentist.
But the key is the clicking jaw, right?
Yes.
No, what is the worst scenario if you don't have this kind of treatment?
I have a patient, she cannot open her mouth.
Okay.
She cannot even eat using the spoon.
Oh, okay.
But
the pain, how about the pain?
The pain is very severe.
Very severe.
From 110 pounds, she lost about 60.
Wow, that's a lot. Wow, because of those particular. And how about the facial deformity? Can you still correct that? Let's say like medyo tabing yung mukha mo, and maybe because they thought it is just probably there's a lot of factors. It can be also because of certain tumors, right?
Yes.
Or some any abnormalities. Do you have to do like an MRI or a CT scan if you feel like your mouth is a little bit deformed
or
asymmetrical? Dr. Valderama, what are the initial treatment, let's say, for having a patient who have like asymmetrical of the face, asymmetry?
Okay, for dentofacial deformities, that means medyo tabingi yung bibig. The first thing I do is to do a thorough consult or assess the family background or the history. Were you born that way? Medyo tabingi na ba yung jaw? And then after we have evaluated these kinds of cases, we send them, the diagnostics are basically the MRIs, the CT scans, the casts, orthodontic cast. And then I also ask consult from an orthodontist. So, because if you reposition the jaw using plates, you'll still need braces or these orthodontic brackets so that it will also help them guide their occlusion.
Okay. Let's say for patients who have like a protruded chin, yung mahaba, parang babalu.
Yes.
Do you still have a treatment for that?
Yes, we can.
How do you treat that? I mean, there's a lot of patients. I mean, me in my clinic consulted for like a patient who have like an elongated chin. I say elongated. In sa atin yung parang babalu, no? Do you have a treatment for that particular?
Yes, you can do, aside from, well, if the problem goes when it is already skeletal. Pag sinabi pong skeletal, hindi na masosolve ng problem by braces alone. Kasi if it's example for severe problems when the teeth are really, really far by maybe a centimeter or more.
Is that underbite?
Yes. Okay. Usually, or that's called mandibular prognathism. So what you do is, may problem yan na skeletal. Pag skeletal po, that's when braces and orthodontic surgery goes hand in hand.
Wow. Do you have any pictures like we could show about the patients who...
Some emergencies some problems that you have already encountered?
Yeah. Like for example, tumors or impacted tooth that make the symmetry of the face?
Yes.
Okay.
This is one. This patient was medically compromised, severely diabetic, has hypertension, and she was not cleared on the first day of consult with me. So we had to wait for a week because she had to undergo clearance from the internist. Fortunately, that day they came for a consult, wala siyang clearance. So we had to wait for a week. But after that, I did her immediately and provided.
So this is a medical emergency?
Yes.
Probably the patient really feels a lot of pain for that because of those impacted teeth.
Yes, for them to come.
Has facial
She couldn't sleep.
I know. Okay. And you can see patients who have this kind of problem. Okay. Now, we have a texter from Mrs. Topacio.
Okay. Wala na po akong ngipin sa taas. Magkano po bang magpa-implant?
Dr. Valderama or Dr. PINEDA, can you? Dr.
All right. I'm not really a true implantologist. Okay. I'm a maxillofacial surgeon, but I think it depends on the range and the brand.
No, right now, what are the, let's see.
Just give you the range, okay?
Is that per tooth or per setup? Or,
alam ko po per implant, per post.
Per tooth.
Yeah.
Okay.
You need at least sa upper, I think depends also case to case. No? So I will just give a range based on the ones I read. If you are going to put 4 posts, and then per post, I think I will give you a range. It's around 60, 80, and 100,000 to 120, depending on the brand.
Per post.
Per post.
So if you're talking like apat na post, it will be like 400,000 more or less.
Yes, I believe so.
Yeah.
Even more.
Even more, right?
Yes.
So you see, for this patient who has like doesn't have any tooth on the upper part, can you still do implants on the whole
or
area?
would you suggest dentures instead?
Dentures na lang?
Well, the thing here is it's more of the financial capability of the patient.
Let's say if the patient is financially capable.
Okay, if the patient is financially capable, we're going to fix first the shape of the arch by putting graft material. Wait for then put temporary dentures. Then after a while, the implants will be set in. Yung iba naman, yung ibang implantologists, they set it immediately. They load the material immediately. It's really case to case.
Kasi the problem is that before kasi yung mga dentists, pag sira ang ngipin, sumakit ang ngipin, they just extract it. Doctor, in your experience, if a patient comes to you with a tooth pain, what are the, I could say, preventive measures for a patient not to have a tooth extraction? What other remedies that you can do?
First, you have to visit your dentist regularly.
Right.
And then, if you notice caries, go immediately for restoration.
Yes.
And if it is possible to be saved, you do root canal.
Root canal. Oh, when you say root canal, can you explain to us for the audience, for our televiewers to understand?
Why would someone need a root canal?
Does it
rather, what is a root canal?
Or it's just like you cut the nerve or something?
No, when the caries is very deep, below the dentine, very near the pulp, you cannot restore it using yung pasta. So you have to do the preparation, expose the orifice, yung canal opening.
Right.
You remove the nerve, and then you enlarge the canal and put final filling.
Oh, so there will be no more pain. So if you just remove the pain. So that's the time we could preserve the tooth, right? Not just like before, you can just extract it right away. Okay.
So dental hygiene is really the key, right? It's very important.
Good oral hygiene.
Okay, let's go to braces, because there's a lot of patients want to have this kind of braces because their teeth are not really arranged in a typical aesthetic acceptable look. Now, what's the indication of braces, and how young and how old you can have braces?
From age 10, you can put place braces on it.
Okay.
But below 10 years old, usually you do removable appliance because they are very young. There are much room for growth of the mandible or maxilla, and usually this stage andyan yung crowding, yung mga ugly duckling stage. So you don't go directly to braces.
Okay. Wow. So we have a texter from cell phone number ending at 8882. Doctora?
Yes, my kid is 6 years old and her teeth sa front, sa taas, and sa bagang, sira lahat. Nangingitim, advisable po ba na bunutan lahat?
Dr. Pineda?
No, not really. But there are...
She's 6 years old?
Yes,
she's 6 years old.
Usually 6 years old, pero milk teeth pa lang yan.
Mm-hmm.
If there are permanent teeth, it's the first molars because it erupts at age 6.
Okay.
But the thing is, there are patients who develop lymph nodes.
Mm-hmm.
Okay.
So you have to make a differential diagnosis first, because kasi symptoms din yun ng primary complex lymph nodes.
Correct.
But if the patient is cleared by the PESA na wala naman siyang primary complex, usually the cause is yung mga bulok na teeth. So you have to extract the tooth, give antibiotics, and then observe, mawawala lahat yung
lymph nodes.
Lymph nodes.
Okay. Doctora, in your experience, let's say for example a patient who's 6 years old wants to have this tooth extraction. Because it's very hard to, let's say, do tooth extraction for 6 years old. Do you have experience in that? Do you have to, ako lang, I have a patient who have like warts. She's like, I think 3 or 4 years old. And we even, I cannot do procedures on a 3 or 4 years old. We even seek a help of the anesthesiologist. We even put him into under general anesthesia. In that case, let's say 6 years old, maybe 5 years old, what is your experience like having this kind of any tooth treatment or dental treatment, having a tooth extraction? Do you have to also sedate the patient with the help of the anesthesiologist?
Yes, in some cases, in severe cases, mostly I admit them in the hospital and then do them in the OR. But in some manageable cases, let's say my financial difficulty in patients, we can choose an alternative like do sedation in them, like give them maybe dormicum or diazolam. Yeah, just for a while. If the procedure.
So who did the sedation?
I can do the sedation. Well, we have a dental anesthetist.
Oh, yeah.
And then I can work with that anesthetist. Sometimes pwede naman bigay per ORM. So we compute the age and the bill, and that's it. If he falls out, and we do the procedure in less than 10 minutes.
Would there be any difficulty of doing procedures for pediatric patient in comparison with adult?
Oh yeah, because they easily react or cry. So the span of time that you work for these children, they have to be first hour in the morning.
Oh, okay.
So their threshold of pain is a lot higher, and they're not so exhausted in the afternoon.
But in terms of procedures, are they more, or are they easier to operate in terms of procedures, or because they recover faster than adults?
I think yes. Well, for the surgical procedures or kids, it's easier to treat them because they easily
recover.
Yes,
they easily heal.
Yes.
Dr. Pineda, what are, this is very basic because, of course, tooth extraction is also a form of surgery, do you have like any contraindication for patients who you want to undergo a tooth extraction? Is there any patient, a compromised patient, a medically compromised patient, which also prevent you from doing
what are the contraindications?
So do you still assess the patient for tooth extraction? Or ask for the medical histories, Dr. Pineda?
Yes, it's very
especially
important.
when the patient is hypertensive.
Hypertensive, okay.
You cannot use just any local anesthetic solution.
Right. Any form of allergy? Any form of allergy?
Yes.
Allergies.
Well, basically, the anesthetic solution, nobody just develops allergy there based on clinical history. Kaya lang sila ka-allergy because of the preservative. So you can get an anesthetic solution which does not have that particular preservative. You will just alternate it.
Oh, okay.
But the most common complex patient that comes to our office are those patients who will undergo radiation therapy or chemotherapy.
Okay. For our last few minutes, do you have any other pictures that you could show us? A bit more cases for dental failures or dental emergencies.
Yeah.
Just a bit more before we end.
Yeah.
All right.
Okay.
Well, these are just some of them. Example, this guy had was playing basketball, and unfortunately, his central incisor got dislodged. Even the other one got moved or was displaced. So they rushed to me immediately.
Okay.
Like
These are dental
hour.
emergencies.
Dental emergency.
Yeah.
A very common emergency, not the basketball.
Yes, hindi niya na po masara yung bibig niya, so they had to rush to my office.
Okay.
We just sedated him, and then we placed a splint.
A splint?
Yeah, a splint that instead of using wires, we used the composite.
Composite, wow.
But of course, the process becomes very tedious.
Do you have like dental emergencies, like example, we use life-threatening dental emergencies? Any cases of that?
Well, but I don't have a picture right now. It's more of a Ludwig's angina. It happened, Ludwig's angina is an acute rapid septic, and the kid could hardly breathe, so they are rushed. Let's say in the evening, di na siya makahinga. Ito yung mga may swelling na bata, nag-a-occur to sa mga 4 to 6-year-old, medically compromised and very poor oral hygiene regimen. So I have to create or put 4 tubes on their face, and then so that the pus will get off.
So it started with very poor dental hygiene or oral hygiene.
So you mean really a good oral hygiene is very important. What's the best? What's the basic, Doctora?
Okay, in brushing our teeth.
Brushing our teeth, yes.
Brush your teeth properly. Don't use hard brushes.
Oh.
Use soft bristle brush.
Okay.
And do not put so much pressure. Brush at least 2 minutes.
How about eating those like hard foods that are really not good for the teeth?
You have to avoid it from time to time, but not all the time.
Oh, all right. Wow, you know, we still have a lot of questions regarding,
more questions.
You know, maxillofacial surgery and TMJ or temporomandibular joints. But because only have 1 hour, but maybe we could invite you again to our program.
For a second episode.
For the second episode of
Perfect Smile Part 2.
Right, there you go. Dr. Pineda, if I want to get in touch with you, where
can our patients contact you?
Tell viewers your office and
my clinic
contact number.
In Intramuros at the back of Manila Cathedral. You can call or text at 0917-816-0112 and 0922-816-0969.
Oh, okay. Thanks for. How about
Dr.
Dr. Valderrama? Or can we get in touch with you?
We have a postgraduate training at Metropolitan Medical Center. I'm usually there on a Wednesday, so if you want to come for free consults, we do our charity cases there also.
Okay.
Some. This is every Wednesday. I'm there from basically the whole day. Even if it reaches the evening, I finish the case. The phone number there is 254-1111, extension 5049.
Yes.
Okay.
And then private office in front of UPPGH. It's in Don Santiago. It's room or unit 201. And the number there is 986-0220.
Oh, okay. Thank you very much, Dr. Valderrama, Dr. Pineda.
We had a very good discussion here.
Icons in TMJ and maxillofacial surgery. Wow, Dr. JONNA Cenica.
Again, bitin.
Bitin yung ating mga discussions. But anyway, we're going to have a part 2 of the Perfect Smile. And so much for that. Hope to see you in the future again. And next week, we'll be discussing again a lot all about aesthetics, all about cosmetic
beauty,
surgery, all about beauty, and of course health. Okay. Now, Dr. JONNA Cenica, we'll be ending up this episode, and I hope will be my next. You're good, huh? You're really doing good.
Thank you.
Yes. Anyway, this is Dr. John Cenica,
and this is Dr. JONNA Cenica, and thank you for watching, everyone. And we are here at
What's Up,
Doc?
There's a tear in your eyes, I know, I can feel that it's not